So, how concerned should we be about a couple of new COVID variants and about a fifth wave of the pandemic? Well, the head of the World Health Organization says the pandemic is nowhere near over, with numerous fresh surges being reported. Tedros Adhanom Ghebreyesus, who was speaking at a WHO emergency meeting, which determined that the pandemic remained a public health emergency of the highest magnitude. The Omicron variant, BA.5, is thought to be behind the new spike in infections in many countries and appears to be able to evade some of the immune defenses acquired by vaccinated people or by those earlier infected. So how worried should we be about the transmissibility of these new variants, and how should governments and individuals respond? With more of this, I'm joined now in the studio by the Director General of the West African Health Organization, or WAHO, Professor Stanley Okolo. Thank you very much indeed for coming in.
Thank you very much, Charles. Thank you for inviting me.
Well, it's always a pleasure to have you here. Do you agree with the WHO assessments that the pandemic is far from over?
Yes. The pandemic, in terms of the severity of infections and all that, is probably on the wane. But in terms of the multiplicity of infections, it's far from over. And it's not unexpected. We know that it's a respiratory virus, and therefore sometimes it loses its, if you like, virility, but it doesn't lose its infectivity. And if you think about the standard, well, we call it standard, but it shouldn't be standard, the normal influenza, it comes in waves at different times of different years. And that's why we continue to have different vaccines, because every year it tends to mutate in terms of the flu itself. But with the pandemic, for us here in West Africa, we have just this week, I mean, starting from Monday, today is only Wednesday, we've already seen about 2,736 cases, mainly in about 5-6 countries, of which Nigeria is one, Cote d'Ivoire, Cabo Verde, Senegal, Togo. So we've seen quite a rise in infections. We haven't, however, seen a very high rise in admissions to intensive care units or in deaths. In fact, we've had only 6 deaths out of these 2,700.
Well, let me ask you about these 2 new substrains of COVID-19 that are causing renewed concern. Tell us about them.
Well, there is the B4 variant and also the B5 variant. They are variants of Omicron. And what happens in terms of the virulence of these vaccines is really the question that, as you said during your intro, they do lose the capacity to be affected by the vaccination. And so they have an immune escape. And that means that they almost change the way they infect the cells. And once they infect the cells, then they start generating some of these infections. The body cells tries to produce antibodies to counter them. The vaccines you have already may not work as well against them. And the B5 has been shown to cause a lot of problems in China. I mean, sometimes they had up to a 60% increase in some of the cases over a week. But what we find is that if people now go on to take boosters, that helps in terms of improving.
Well, because what I was going to ask you, I mean, ordinary people, most of us are not as intelligent as you are, or as, science understanding as you are. I mean, the fundamental question for most people is how significant a challenge do they pose? Do they have features that make it difficult to tackle them?
Well, they do in terms of the rapidity of infection. But let's just understand that COVID and the variants do not have the same impact on everybody. So if you're over 50, if you have comorbidities, then you must absolutely take extra precaution with this, because that's what could put you in the intensive care unit. That's what could put you. It's not a simple infection for a 68-year-old as it would be for a 22-year-old.
Sure.
And so it's really important to show that and for people to understand that. And therefore, although we haven't really come out with West African directive in terms of what we're having a meeting tomorrow with the experts, all the directors of the national public health institutions from all the 15 countries. But the sensible thing to do is what we have always done, which is to now become smart in terms of how we target. We're not going to go back to blanket lockdowns, but if you're moving into crowds, if you're in built up areas where you are with a lot of people, then it's sensible to practice social distancing, wear masks.
Right, but in terms of how sick these variants make people, you're essentially saying that people are not being hospitalized.
Yes.
It's not to that extent.
Yes, across board.
Right.
Don't panic. However,
panic.
No, don't panic. However,
Right.
if you have comorbidities,
Right, then you should worry.
Exactly.
But
worry is not really the, and you should take extra precautions.
But
it's not that you should worry.
is it a situation where people are getting reinfected? I mean, ordinary people over a short space of time, even if they've had perhaps another variant of COVID recently?
We don't really have that
Right.
data in terms of saying,
Yet.
it is this and that. We don't
Right.
have that data yet. But what we know is that having a previous infection does not necessarily prevent you from having another infection, particularly with these viruses. And then the other thing we also know is that booster doses, if you have had your last vaccination about 6 months ago, you must go and get a booster, particularly if you're not young, if you're
Right.
not if you're in the older age group, and if you have comorbidities. It's really vitally important.
Right.
And this is really how to protect yourself, because the problem we have in West Africa at the moment is the fact that everybody thinks that COVID has gone. We really need to ramp up the risk communication again.
Right.
And we haven't even reached
Sure.
some of the targets that we want to reach in terms of vaccinations.
Right. So in that respect, then, what should West African governments be considering? Having masks back, renewed testing and tracking, another booster shot you mentioned?
Yes. Not necessarily having masks back as a universal masking, but definitely in terms of those areas that are almost a super spreader event, we must make sure that we have masks.
Right.
Now, you think about when you are in the queue at the airport or where people are crowded, you must have your mask. Then, of course, at the moment, we are ensuring that if you're fully vaccinated, you usually travel without testing. But if you're not, we offer you vaccination across all borders, and that is mandatory for the whole of West Africa.
And
one of the other things that we are then
Sorry.
moving on to do is to do point testing, so that we are looking at so many of our countries, because one of the things we found is that the level of antibody protection in our population does not always correlate. It wasn't previously correlated, and it doesn't often correlate with the level of vaccination. So we find that some of the tests we had done in cities about 3-4 months ago, there are countries where the vaccination rate was about 16-20%, but the antibody prevalence was almost 60-70%.
Right. Okay, well, we're going to move away shortly from all of this, but before we do, BA5, this new variant strain, is being seen in a different way because it's such a distinct variant from the Omicron. Yeah. It's said to be causing big problems in America. We're also seeing BA2.75, which has been seen in India and a few other places around the world. But what sense do you get about the picture here in Nigeria and West Africa? Is that strain prevalent here? Is the positivity rate getting high again?
We think it might be. And why do I say that? Because not only have the vaccination rates fallen off, the testing rates have fallen. It's not just here in Nigeria, it's generally, but also the sequencing, because we used to do typing of and we do about 10%, sometimes 20%, to know what variant it is. We are now ramping that up. You talk about the CDC here in Nigeria, and all the national public health institutions are ramping that up so that we will know. But yes, the variant of Omicron is what we think is driving this up.
Right.
And by the way, the other thing we also monitor, we said this from WAHO about 2-3 weeks ago, because the moment within a week we notice across the 15 countries that we'll have up to 400-500 cases, that means we're going to hit a wave.
Right.
One of the things that happens is that our waves are usually about 3 to 4 weeks later than the waves in Europe and America.
But it's coming.
But it's coming, and we'll have to be careful.
Well, let's go beyond COVID and look at the organization that you lead, the West African Health Organization, WAHO, which is marking its 35th anniversary. How much has it been on the front line of healthcare in West Africa in that period? Has it risen up to the demands of the moment and of history?
I think the West Africa Health Organization has been a fantastic resource for the region in terms of, by the way, it was created in 1987. It didn't really take off until it had its first Director General in 2000. So it has really been running, operationalizing for the past 22 years. However, having said that, it is important to know that one of the things we do, for example, you can train in any specialty in Nigeria and you go and work in the Gambia. You can train in one country and go and work in the other because of harmonization. We have a process of COVID was one of the ones that showed it, of making sure that we harmonize the policies and also harmonize the training, harmonize, of course, not only the policy and the training, but the movement of staff. WAHO, if it was not there, it would have been extremely difficult to tackle COVID. And of course, as you know, this is one of the things that we were complimented about, not only in West Africa, but across Africa and globally, about the way we could together use a regional approach to ensure that the whole region of 400 million people is something. And that's one aspect. The other aspect we're going to be thinking of is we're now talking about regional manufacture of pharmaceuticals. Previously, 60 to 70% of drugs that we utilize here are all imported. We're even now talking about manufacture of vaccines. So WAHO has done a lot in terms of pushing on the frontiers of this. And that is why the heads of states and the ministers and the countries themselves always look up to WAHO for its direction in terms of...
And talking about things that you're being commended for, I understand that you yourself are preparing to bow out as Director General of WAHO. You've been commended for the work you've done in that organization, and in recognition, President Buhari conferred on you the award of National Productivity Order of Merit. How do you reflect on your time as Director General of WAHO? And we've got about a minute or so.
It's been challenging. Of course, as you know, it was a culture shock coming from over 30 years of practice in London to Bobo Dioulasso in West Africa, but it's been an honor and an opportunity to lead that organization. The one thing that I will take away is the fact that I think we need to capacitate that organization to the next level. WAHO is now well known internationally. We were at Kigali Summit chairing the first session with ministers from the UK, Nigeria and all that. WAHO is now invited to international. But when you talk about WAHO, people say, where is it? It is in the second city of Burkina Faso, hidden, and it shouldn't be there. It should be in Ouagadougou. The interdependencies are necessary in order to improve the outlook and the performance of the staff. I think that is really critical.
I hope the people who make decisions are listening. But Professor Stanley Okolo, I want to thank you very much indeed and add my voice to those congratulating you for the time that you've spent as Director General of the West African Health Organization.
And thank you so much for the support. And also, I think it's vitally important for the media to continue to help us with this risk communication and telling people COVID is not finished.
Right.
But it's important to be smart about it.
We'll certainly do the best that we can. Thank you very much indeed.